The Puple Surgical Ultimate Endoscopic Linear Cutter Stapler and Reloading Unit places 2 triple staggered rows of titanium staples and simultaneously cuts and divides tissue between the 2 triple staggered rows. The universal handle is available in 3 shaft lengths: 6 cm, 16 cm and 26 cm. Each universal handle accommodates 30 mm, 45 mm and 60 mm straight and articulating reloading units in 3 staple sizes: 2.5 mm, 3.5 mm and 4.8 mm for varying tissue thickness. When using either a 2.5 mm or 3.5 mm reloading unit, ensure a 12 mm trocar is used in conjunction with the device. A 15 mm trocar is required when using a 4.8 mm reloading unit. Each device can be reloaded up to 24 times for a maximum total of 25 firings on one patient. The device can be applied in abdominal, gynecological, pediatric and thoracic surgery for resection, transection and creation of anastomosis. Remove the Ultimate Endoscopic Linear Cutter Stapler and Reloading Unit from the product packaging. Check the return lever is pulled back fully prior to connecting the reloading unit to the universal handle. Securely lock the reloading unit firmly into the pin located at the end of the shaft by aligning the load indicators and twisting 45 degrees anti-clockwise. Remove the shipping wedge from the reloading unit. Do not attempt to remove the shipping wedge until the reloading unit is locked into the universal handle. To check the reloading unit is successfully loaded within the universal handle, squeeze the firing handle once to close the jaws of the device and pull back the return lever to fully reopen. Once you have confirmed the reloading unit has been successfully loaded within the universal handle, squeeze the firing handle for a second time to close the jaws of the reloading unit and pass it through the trocar cannula. Ensure the anvil of the reloading unit has fully entered the body cavity and passed through the trocar cannula before pulling back on the return lever and opening the jaws. Using the 360-degree rotational wheel, position the tissue to be stapled between the jaws of the reloading unit. Articulating reloading units allow for further maneuverability when the articulating lever is turned from left to right. Only tissue positioned within the cut mark lines will be transected. Additional reloading units may be required for tissue exceeding the length of the cut mark lines. Close the jaws of the reloading unit across the tissue to be transected by squeezing the firing handle. The jaws of the device may be repositioned on the tissue prior to firing by fully pulling back on the return lever, allowing the jaws to reopen. Once the correct positioning of the tissue to be transected has been established, allow 5 to 10 seconds for tissue compression. Press the green safety interlock button. The device will not fire staples and cut tissue unless the green safety interlock button is pressed. Fire the device by repeatedly squeezing the firing handle. The number of squeezes to fully fire the device is relative to the length of the reloading unit. Once the device has been fired, pull back on the return lever to open the jaws of the reloading unit and gently remove the device away from the transected tissue. Inspect the staple line for hemostasis. Close the jaws of the reloading unit by squeezing the firing handle and remove the device from the trocar cannula. When using the device more than once during a single procedure, remove the empty reloading unit and reload a new one into the device. The safety interlock will prevent an empty reloading unit from being fired a second time. To remove the reloading unit from the universal handle, pull back on the return lever to open the jaws, and then pull back on the unload button, twist 45 degrees clockwise, and remove the reloading unit from the shaft of the device. For full directions for use, always refer to the DFU leaflet in the product packaging.